There's generally not a great deal of awareness around behavioral health needs in our community and what that looks like. Even in those scenarios where there are, sometimes there's a challenge with stigma. People associate behavioral health with stigma. People don't like talking about it. People are uncomfortable talking about behavioral health conditions.
Was mental illness all around us? It can be your neighbor. It can be your family member, but you may not ever know. They may be suffering with depression and not knowing what help that they can get.
So even when people do recognize there's a need for services or need to get someone help, they don't really know about how to go about getting those individuals help. And sometimes people deteriorate and experience more and more symptoms of their condition just because people don't know how to help them step in and help ensure that they get some assistance.
I'm passionate about people, and so what keeps me coming back day after day is because of the community that JPS provides within the staff interaction as well as the patient care.
We don't just treat the illness, but we treat the whole person. So it's a holistic approach to what we do here, and there's a need for that.
JPS saves lives, and as peer support, we're often told that peer support made a huge difference. So the fact that JPS would recognize and bring peer support in is definitely a plus.
JPS has a fairly large behavioral footprint. We provide a great deal of services across our community, everything ranging from emergency psychiatric crises to inpatient care, as well as outpatient and ongoing supportive counseling and supportive care for our community. The people that need our services run the gamut. There are people who have resources, people who have no other options and no resources available to them, and we're here to meet our community's behavioral health needs regardless of the ability to pay.
So here at Trinity Springs, there is a courtroom at our mental health hospital because it allows convenience for the patient as well as the families to be able to attend court in regards to their loved ones' commitment hearings.
If you just think about the logistics and safety concerns alone with having to transport patients routinely down to the courthouse for those hearings, it becomes logistically very challenging to keep those individuals safe to the degree that other hospitals actually bring their individuals here who need to have commitment hearings or go through the court process. Nationally, they estimate that $193 billion a year is lost in lost earnings due to serious mental illness. And obviously with a community like Tarrant County that's growing as rapidly as it is, that's an impact to us.
Mental health is an illness that has been long forgotten, but now needs to be addressed. And the need for facilities, the need for a focus on mental health in this community is at an emergency state. And JPS is the leading provider of mental health services for our community.
I'm passionate about an organization who seeks to constantly improve and excel on every level.